Now we're going to do the sterile procedure of putting in a Foley catheter. One of the first things that you need to do after you get an order is to gather your equipment. You'll have a Foley catheter kit. Sterile gloves are in the kit, but they're medium size. So if you have larger hands or you have hands that are extremely small and want to get a more fitted sterile pair of gloves, then you can do that. The other piece that will be taped onto your bag will be this, and it's a stat lock. The ones you have in your kits are not the correct one that we use in the hospital, but I'll show you how this works in a minute. So the first thing that you do is go in and explain the procedure to your patient, and then you put on regular gloves and examine the perineal area. You want to make sure that your patient is not soiled or has been incontinent and is extremely wet. So you want a clean environment for you to work with before you do a sterile procedure. So we're going to check our patient. You want to make sure that you leave them covered up as much as possible. Some patients do not do real well with being able to move their legs, and I will tell you that putting in a sterile Foley catheter is a 2 licensed procedure, so you've all got to have a buddy with you when you do this procedure. But you want to examine the perineal area, and it's also a good idea for you to go ahead and spread the labia and clean in there so you kind of know where your landmarks are and you know where you've got to work with from there. So at that point, you wash with soap and water and pat dry the patient. And you take those gloves off and wash your hands. And then you prepare your Foley catheter kit. This is a good trash can for you to throw everything away in, so don't just toss it. You see this little label right here? If you ever have a patient that comes from a nursing home, Foley catheters are changed out every 30 days in a nursing home, so we need to know the date and when it was inserted. But most of the time, if you have a patient that has a Foley catheter at home, one of the first things that we do in the hospital is take out that Foley and insert a Foley catheter using our sterile technique in the hospital. The reason why we do that is we do a urine culture because we want to know on admission if that patient came in the hospital with that infection. If that is the case, then insurance will pay for it. If we cause the infection, then insurance will not pay for it. So you've got to make sure. When you open this, remember the inside of it is sterile. So you can turn the tray however you want to. Let me do it this way. Okay, you're opening it away from you. And this will flop back over on you, so that's why it's good to have a second buddy in here. And you reach around to get your, and then I'm touching the outside, so nothing that is going to be close to the patient, this is all going to be on the bed. So I'll turn it around this way, so I've got me a nice little square sitting right here. Okay, then the first thing you've got in here are gloves. If you can't wear mediums, and I will tell you, what you do is just lay them down. They're quite wrinkled up in here, so sometimes they're a little bit difficult to put on. Now, when we're talking about putting on sterile gloves, everything's above your waist. You never turn your back onto your sterile field. So once I'm in this position, I'm okay to turn this way, but don't leave everything sitting over here and you turn your back to your patient. That's breaking sterile field. So you put your gloves on, and they're marked where the thumbs. So this means this is my right hand. As long as you're on the inside of that cuff, that's okay. And these gloves are a little bit big for me, but that's okay. Then what I do with my gloved sterile hand is I get my fingers up underneath the cuff, stick my hand in there, and get the glove position to where your thumb. Now you see my fingers didn't go in the right spots. It's okay for me to touch this glove now because I've got sterile gloves on. So what you do is just rearrange everything and then pull down. And once you get the glove on, you don't want to touch the cups or anything because you'll end up breaking sterile field. So for a female, this is an extension of your pad that you have on here. Shiny side down. You want to put this up underneath the patient, and this is where you get somebody to help you. But as long as your hand is in the sterile field and you aren't touching the patient, then you are maintaining sterile technique. This pad, the only time that I use this particular pad, if I use it at all, is on a male patient where you could lay this across the area. But on females, especially if their anatomy is difficult to find, then it's not the easiest thing to do. So I usually don't do that. So then this top tray can be moved closer to the patient where you've got all your supplies that you're going to clean with. In the lab, you're going to have saline swabs. In the hospital, they're going to be betadine. You got to check with a patient before you start this process and find out if they are allergic to betadine. So, and then I can squirt some of my lubricant into my tray. And you should see I just tossed it. You cannot touch any of this. So I've got my swabs, I've got my lubricant. Then you see this Y site right here? You take this syringe with sterile water in it and connect to this part. And this is what blows up the bulb that actually holds the catheter in place once it's inserted into the bladder. So you take this part off, and I usually will kind of wrap my fingers around because it's very pliable and you'll end up breaking sterile technique if you don't. So I usually put my catheter down in my lubricant and everything's set up and ready for me to go. The reason why I do all of this ahead of time is because once I get my non-dominant hand, for me it's my left hand, planted and I'm holding the labia opened, that hand is no longer sterile and it has to stay in that spot. So you spread the labia to where you can see the urethra. And I'll be honest with you, on these mannequins it's very difficult. You want to swab on the side furthest away from you, down, go around your sterile field, the side closest to you, around your sterile field, and then your last swab goes right down the middle in the area that you're going to be working. Then I take my lubricant out, my catheter out of the lubricant. I tell my patient to take a deep breath, and I start to push it in. I say, breathe, breathe. Once I start to get urine back, I advance a couple of more inches, and then I let go, but I hold on to the catheter because these catheters will slide right back out if you don't. So then I inject my 10 cc's of saline. And once this is injected, you have to hold on to the plunger and twist this off, because if you don't, the pressure on the inside of that bulb will make the water come right back out. Then I pull on the catheter until I meet resistance, and I will show you what the bulb looks like in just a minute. And then you see I've got urine in here, and I would hang this on the side of the bed. Now, so really you're done at this point with the sterile procedure. So this is the stat lock. There's a little slit right there, and this slides right up to that area. This pops over there. Then you peel this off and put this on a patient's leg, but you always want to make sure you've got some slack, because you don't want it pulling on one side of the labia or the other. That could cause skin breakdown. So you want to leave you enough wiggle room there. And then when I put it on the side of the bed, I usually will leave this kind of rolled up, and I use this clamp to put on my draw sheet or something, and then underneath the bed there is a little metal hook that it hangs on. Now, some of the things that you have to measure right when you put the Foley catheter in is, well, you have to describe how the patient tolerated the procedure, the urine, what it looked like, the color, the consistency. But if you've got a patient that is really, really distended and you're getting back close to 1,000 milliliters, then at that point in time, you need to clamp off this catheter. The easiest way to do that is take this, and what I do is just fold it over, and then I clamp it off like this and just tighten it up. And the reason why I do that is because if your patient's bladder has been really, really distended and all of a sudden it is shrinking down, that can cause severe bladder spasms. So we want to let the bladder rest for about 30 minutes, and then you can drain the rest of the urine out. But it's just really in your patient's best interest so that we're not causing any pain for your patient. So if we, so this stays in. If you're working on a surgery unit, they'll come back with a Foley catheter. The Foley catheters are usually out within 24 hours. And if not, if you're in an ICU and the patient's on a ventilator, then they're documenting what's going on with that patient and the reason why they need the Foley catheter. Foley catheters sometimes have to stay in just because of maybe a surgical procedure that maybe accidentally nicked the bladder or something. So to take the Foley catheter out, you take it out of this, and this is still going to be on their leg. What I usually do is get a washcloth to put up underneath the perineal area, but take you an empty 10 cc syringe, and as you can see, the pressure that's inside that bulb is just pushing the water back out. So you want to make sure that you get all 10 out or as close to it as possible. Then I put a washcloth underneath the perineal area, and I just say take a deep breath and just pull it out like you learned to do with an NG tube last semester, and I just wipe them off. Now this is what it looks like on the inside of the patient. So this is the actual bulb, this is the actual bulb that you're pulling down toward the base of the bladder, because the holes are around here at the top. So that's the part that's actually holding it into place. So that's why it's really important for you to know. The holes are up here for it, but see, if I let go of that plunger without twisting off that syringe, you can see the pressure in this bulb is, the saline is going right back, or your sterile water is going right back in there. So that's why it's really important when you're inserting the catheter to push that down, hold it against your hand, and then twist it off. And then that way your bulb stays inflated. Okay?